now turn to speak to new clause 21, directions to public authorities on recording of sex data. Now, you don't need to be a doctor to know that data accuracy is critically important, particularly when it comes to health, research, or provision of tailored services based on protected characteristics such as sex or age. Accuracy of data must be at the heart of this bill. And nowhere has this been more high profile or important than the debate over the collection and use of sex and gender data. And I want to thank the charity Sex Matters and Noble Lords of Buffnott and Lucas for the work they've done to highlight the need for accurate data and its relevance for digital verification system proposed within this bill. Of course.
Thank the Honourable Member for giving way. The recent decision by the Supreme Court that, according to the Equality Act 2010, sex in the Act refers to biological sex at birth, regardless of whether they hold a gender recognition certificate or identify as a different gender, has left many trans people already feeling hurt and unseen. I would suggest, and I wonder if he agrees with me, that any digital verification service and ID must consider trans people and not risk making them feel like any more like their country is forgetting who they are.
Well, I thank the member opposite for her intervention. I'm going to come shortly to the impact on all people in terms of the decision of the Supreme Court. Our amendment's focus and scope within this bill is simple. The Supreme Court ruling made clear public bodies must collect data on biological sex in order to comply with their duties under the Equality Act. Our amendment ensures this data is recorded and used correctly in accordance with the law. This is about data accuracy, not ideology. Our amendment is based in part on the works of Professor Alice Sullivan, who conducted a very important review with deeply concerning findings regarding inaccurate data collection and conflation of gender identity with biological sex data. She found people missed off health screening, risks to research integrity, inaccurate policing records and management through the criminal justice system, and many other concerns. These present risks to everyone, irrespective of biological sex, gender identity, or acquired gender. Trans people, like everyone else, need health screening based on their biological sex. Trans people need protecting from sexual predators too, and have a right to dignity and respect. The Sullivan report shows beyond doubt that the concerns of the last government and leader of the opposition were entirely justified. The government has had Professor Sullivan's report since September last year, but still the Department for Science, Innovation and Technology have not made a formal statement regarding it or addressed the concerns raised, which is even more surprising given its relevance to the bill today. The correction of public authority data on sex is necessary and urgent, but it's made even more critical with the implementation of digital verification services within this bill. With pleasure.
Gentleman for giving way, and the Shadow Minister, because he is making an important point on the Sullivan review and also on the Supreme Court judgment, which I appreciate. But I'd like to say that there are conversations on in government and with colleagues on these benches to ensure that the Supreme Court judgment and the Sullivan review is implemented properly across all departments, and I hope to be working with them on that.
Hear, hear.
Well, I thank her for her intervention and all the work that she and colleagues on both sides of the House on this area. And I hope that we do see the Sullivan report implemented and its findings implemented as soon as possible. And part of the implementation will be made possible if colleagues across the House can support our amendment today. Because the implementation of digital verification services, for them to be brought in, it's important that the data used to inform them is based on accurate and correct data. The digital verification could be used to access single-sex services, so it needs to be correct. And if sex and gender data is conflated, as we know it is in many data sets, then a failure to act today will bring in self-ID by the back door, which, to be clear, has never been the legal position in the UK and would conflict with the ruling of the Supreme Court. Our amendment is simple and straightforward. It's about the accurate collection and use of sex data and rules to ensure data is of the right standard when used in digital verification services, ensuring single-sex services are not undermined.